Okay, g'day. We did go to Smilow Cancer Centre yesterday at Yale in Connecticut, and we discovered a TIL therapy that they're using, and it's not available in Australia. Clint, would you like to elaborate a little bit on that and how it works, and tell them a story about Bob too?
Yeah. So very quickly, the TIL therapy is something we didn't really know about before yesterday, and we went to the Smilow Cancer Centre and found out all about it. It stands for the TIL therapy stands for the T-Cell Infrating lymphocytes, and what they do, they commonly occur in the body when there's a tumour, when there's a cancer. The body starts trying to make these lymphocytes that are going to start attacking that tumour. So what they do is, they find a tumour that's big enough, that's going to have enough of these cells on it, and they remove that tumour, and they actually culture and cultivate those T-cell lymphocytes in the pathology lab. And they have to get over 50 billion of these cells before they can be pretty confident that they're actually going to do the job and be re-administered into the body.
It's just out of this world.
And fight the melanoma. So we met Mr. Bob Heffernan yesterday, which you may have seen on one of our other blogs, and he had this procedure done with him, and it's important to note that this isn't used for your primary melanoma and your early stages of melanoma. This is used for stage 4 melanoma, where it has spread sort of around the body, and maybe surgery is not an option anymore. So Mr. Bob Heffernan had this put in. He had 67 billion of these cells cultivated, and he had these T-cell lymphocytes put into his body over the course of 35 minutes, which sounds like that might have been a pretty easy procedure, but it's not. He said it took 3 months of his life, because you have to pass test after test after test to make sure that you're going to be able to have this. And he was really sick at the time, because they have to lower your immune system right down before they put it in, so that once these T-cell infiltrating lymphocytes go into the body, they can find the tumour and they can try to break it down and get rid of it. And in Bob's case, it looks like it's working.
15 months.
So
15 months he hasn't had a tumour. He's got two little spots in his chest, but they're thinking there might be
scar tissue.
Scar tissue, yeah. So there is hope there, and then, if we can bring that back to Australia, that's going to be a great thing.
So we're learning a lot of new things along the way here, and stuff that we can hopefully really help people back in Australia as well. So
and especially us being melanoma patients, it gives us so much more hope.
Yep.
That if something was to happen, there's better treatments out there. So it was a great day yesterday, and still more to come. So keep watching our blog, melanomaroadtripusa.com. We're going to keep you updated. We've got a few more hospitals to visit, so we'll talk to you soon.
Take care.
See you later.